Hello, everyone. Well, if you're watching this, you've been recommended some at-home care for your neuropathy. We want to do two things at home that your provider will let you know as far as how often that you need to use them. The first thing to do is for blood supply. We're going to talk about that first. And the next thing after this video, if you've also been recommended, the rebuilder is used for nerve supply. So first of all, to promote blood supply, we are a big fan of the red light and near infrared light boots. We use NeuroCare. They back their product really, really well. And with this, your provider will unpackage your goods for you. And there is a port controller. We'll show you how to plug that in, and then also how to place on your boots. Now, please note that these boots do not go through any clothing, so make sure to take off your pants, your socks, your shoes, because they will not penetrate those. And I like putting the logo up the top so it's not upside down like this. You'll find out why in a second. So placing your boots in, they're both the same size, but just place your heel right in the crevice of this, and then place on your boots just with the Velcro straps. They don't have to be tight, just nice and snug is totally fine. But placing like this. And then when you do the bottom Velcro, please just don't flop it on the carpet, especially if you have any pets or anything like that, because they will not replace the product because the Velcro has gone bad. So partially lift up your foot just slightly as you put your Velcro on this way for the top and bottom. And you can see how it's a little bit loose, totally fine as the way it fits. Your other foot would be just the same. We'll do it quick here. Putting this one on so you can see how easy it is to apply the boots. Now these same, I'm calling them boots, but basically they're pads, because these same pads can be used for your hands as well. And we'll show that and demonstrate that for you in just a second. But again, lifting it up, and you're ready to go. And the reason why we put the logo at the top, because the plug-in for the boots would be up here as well. If not, you're bending way on over and you're trying to plug them in at your toes. So you'll have your port controller that you'll be plugging into the wall, and that is there here. And to turn it on, there's a switch on the bottom. And what you'll see a little bit of a countdown that'll take place. And once it counts down, you'll see 21A. 21 means the minutes, and the A behind it means the setting that it is. So you're using these for neuropathy. So think N for Nancy, N as in Nancy for neuropathy. So placing your finger on the top button and pushing the mode setting, bring it to the N2 setting. N1 is 21 minutes, and N2 is 32 minutes. So once you're on N32, you can plug in the port controllers. Note that they're all the same size. You can't plug them in one end wrong. And then you would place these into your boots as well, plugging the top one into this boot and plugging the top into the other boot. You're ready to go. Now, after you're on the N2 setting, the button right below the top one is on. And once you place that, you'll see that the boots are currently active and going. Now, you can't see near infrared light, but that's what's doing the most good for you. You can see red light. And they put red lights on the boot just to make sure that you know that they're on. You're going to see this toggling back and forth back here. It says 73, that sort of thing. Don't worry about that. That's just the algorithm that they use for the machine. And you're going to see this 32 going down to 31, 30, and so forth, down to 0. Once it's off, you can just turn the unit off. So pretty simple. There's a plus and a minus button down here as well. Don't worry about those. That's just to change frequencies and that sort of thing. But everything's been pre-programmed for you. So basically, turn the unit on. Go to N2, neuropathy 2, N2, plug your boots on, and push start. So if you want to get fancy, somebody calls you, you have to get the phone or get the front door, you can push the second button here, which is a play pause button. And when you place this, it pauses the red lights. After you've answered the door and come on back, you can just push start again, and then your time will resume. So that way you don't have to keep track of where you're at. So that is the red light and near infrared light boots. And your doctor will let you know how to use them and how often. I like to use these boots first because it creates vasodilation. And whenever we have dilation of our blood vessels, it brings blood flow to the area. So I like to start off with the boots first if you're using this and your rebuilder. So for application for hand use, it's really simple. You have 2 pads, 1 for each hand, of course. And once again, you can leave on your rings and things like that. However, make sure to take off any long sleeves, anything like that, so making sure that you're getting full use of them. So you basically just place your hands in the center of the pad and place this one on top like this. Then you would place your other and get the straps out of the way of the lights, out of the way of lights, of course. Just move the straps out of the way, and then place your other hand right in the middle here and place that one just like that, and you're ready to go. Same thing, just going to N2 on the controller and start. Pretty simple. So after you're on the N2 setting and both hands are in here and ready to go, reach one hand out, the second button from the top, place it, the lights will come on, put your hands back in, and then you got your 32 minutes applying it to your hands. When you're storing your pads, please put the straps right towards the middle. And then after you've done so, just kind of fold them to the middle. That way, the straps are in nice and tight and they're not left loose collecting hair or dust or anything else of the sort. So fold the pads to the middle and then fold them on themselves. So the other rebuilder that I'll show you has a carrying case that comes with it. However, for your pads, we have this carrying case here where everything fits in nice and easy. So just an FYI, not only symptoms of neuropathy, you can use the NeuroCare boots. However, you can use them for other aches and pains and also cosmetology uses. For aches and pains, right when you turn on a unit, you're going to see the setting A that comes on here. That is for aches and pains. So if you have an ache within your back, feel free to place the red light pads up on your back and leave it on the A setting and hit start. And if you wanted to use it for cosmetic uses and that sort of thing, push the mode button until you go to C, and C is for cosmetic. If you do apply it to your face, please use appropriate goggles. But for your hands, your back, your neck, things like that too, the C application and start there as well. You'll be provided a sheet that is giving you instructions upon everything that we just went through today, and also a sheet that'll show the A, the C, and the N setting that you're going to be using for your neuropathy. Wanted to let you know that if you wanted to use your red light pads on the go in the car, we do have the little converters here at the office most oftentimes, or you can buy them online, or you can just plug your red light pads into the cigarette outlet of your car that you used to use them for their 12-volt. However, please note, please only use these products as a passenger. Never recommended ever to use these products while you're driving, of course. After we've had all of our NeuroCare boots in our to-go bag, let's go on to the rebuilder that you've been recommended.